where we were so rudely interrupted by me going over 15 minutes, is talking about the nasal sinuses. Now, the paranasal sinuses are cavities found within bones that reduce weight and they produce copious amounts of mucus. The ones inside the ethmoid bone here are called air cells. So it's just pockets of spongy bone that form these air cavities, and they're lined with pseudostratified epithelium that produces copious amounts of mucus to warm and moisten the nasal cavity. So I showed you the maxillary one. If we look over here at the sphenoid, this is where the sinus would be. The sphenoid actually has coverings over this, and the coverings have just two little holes that empty in. This one, they want to show it. It surprisingly doesn't have it on the frontal bone. I'm guessing that is where it drains in right there. I am not 100% sure because, again, the ethmoid bone actually has to click into place. So don't completely quote me on that one for where the ethmoid bones. And in lab, I'll have a 360 model where you could actually rotate it and see where all of these are. Now, on the test, I might ask you which bone has a sinus, which bone does not have a sinus. So, the hyoid bone. So this is the hyoid bone. It is superior to your Adam's or your Eve's apple. And it has some horns. It's very devilish. See the two little horns on top? These two horns are called lesser horns. These on the back are actually called greater horns. And it sits at the top of your larynx. It actually has ligaments attaching to the cartilage that forms your Adam's apple. It's called your thyroid cartilage. So this is the hyoid bone. Its fun fact is it's not connected to any other bones. It has ligaments attaching it to the trachea and the larynx. It has muscles attaching it to the mandible, but it does not directly articulate. So it's U-shaped. It's around the neck. It articulates with no other bones, but it has ligaments that hold it in place. And it provides support for the tongue, attachment for tongue muscles, the neck muscles, a whole bunch of muscles we'll learn about. And if you ever hear they know that the person was killed by strangulation, usually this bone gets broken. Oh, on the test, I also like going, what would happen if I broke this bone? Apparently, I'm a very violent person on tests. So, PSI, San Ramon, they found out the person died by strangulation. Which bone was fractured? That let them know this. Was it the zygomatic bone? Nope, that's your cheekbone. Was it the frontal bone? Way too high from your neck. Occipital bone, that would be a blow to the back of your head. So, it must be the hyoid bone. The alveolar processes are found on all the facial bones. Nope. What are the alveolar processes? Oh yeah, there were teeth are found. The mandible only. Watch out on standardized tests for the word only, especially if it's answer choice A. Usually it's going to be that plus something else, or it's going to be completely wrong. The maxilla only, or both. It's both. Which bone do I find a nasal sinus in? Nasal. That is an evil trick I just did. The word nasal is in your question. Do you know what standardized test writers do? They intentionally use a word in the question as one of the first two answers to throw you off. So that is not it. Lacrimel. No, it does not have a sinus. It has a nice hole that tears drain out. The maxilla. Yes, it has one. Has the largest one. It's the one that drains where. And the mandible, nowhere near your nasal cavity. So on this question, I might ask you which one has it, which one doesn't have it, which bone, what they do. So I will ask something about the nasal sinuses. Which facial bone is unpaired? So remember, you have to know which bones are facial, which are cranial, which are paired, which is unpaired. So the inferior nasal concha, those are the ones inside your nasal cavity. Those are definitely paired, so it's not that choice. The maxilla, there's two of them. The nasal bone, there's two of them, so it must be the vomer. And I didn't tell you the vomer. I had a student, must have been 6 years ago now. Her name was Cindy, I think. And she said She remembers Vomer from Lord Voldemort because he does not have a nose. So, we're going to look at the sutures now. And you'll be able to tell me which bones have sutures, or the major sutures. And we'll talk about these fontanelles. I've seen 20 billion spellings on Google about this word, by the way. Not that I'm bitter or anything. So, let's talk about sutures. A suture's anywhere two skull bones come together. So, grab the skull that happened to be laying right in front of me. All of these, between the sphenoid and the parietal, and the sphenoid and the frontal, and the sphenoid and the temporal, are sutures. Where you have the zygomatic process of the temporal bone, where it meets the temporal process of the zygomatic bone is the temporal zygomatic suture. Not on your test, by the way. Now, I just have to go over the four major sutures with you. So, the first one, since it's here, we have right here, and I just realized you could not see my mouse on any of what I just talked about. Right here is a round suture. Remember I lied to you and said squamous epithelial is squished flat? Squamosal actually means round. Now back here, we have a suture that looks like the Greek letter L. That's called the lambdoid suture. I honestly do not think it looks like a lambda because I have this little thing that I stick up on my lambdas because my grandfather taught me how to write Greek. I don't remember anything besides the lambda, but he taught me how to write it. Doesn't look like a lambda, but apparently this looks enough like an L. And it goes all the way down. I thought we were going to talk about vertebrae next, so I moved my station. So it goes all the way up to here, then all the way back down the other side. Now here, we have a suture that goes right down the middle of our parietal bones, separating a left and a right. What was something that separated a left and a right? That's right, it is sagittal, so this is the sagittal suture. Now, lastly, we have this thing right here. And this suture is going to separate to a front and a back. And I gave you two words for that. I gave you frontal and coronal. This makes a crown across the top of your head, so it's called the coronal suture. You are actually born with a frontal suture. You hopefully have only one frontal bone now that you're adults, but when you're born you have two, and the frontal suture is actually between the two frontal bones. So, sutures are immovable joints between cranial bones. So what I was pointing to on the skull that you couldn't see was here's one between the sphenoid and the frontal, here's one between the sphenoid and the occipital, here's one between the sphenoid and the ethmoid, here's one between the ethmoid and the frontal. So they are all sutures. We're not going to worry about any of their names. We only care about the four major ones. This right here, that is on top. I'm using my mouse still. Eek! Right there on top of the temporal bone that separates the parietal and the temporal bone. So this right here, that right there, that is called the squamosal suture. Squamos actually means round. The suture that is over here, that is going up between the frontal bone and so it's going this one right here. Oops, that one right there is the coronal suture. And again, it's making a crown, that's why it's called coronal. And you actually were born with a frontal suture right there. Over here, this allegedly looks like a Greek lambda. Oops. That is how I draw my lambdas. And then this is sagittal. So we've already had sagittal. So those are the four sutures. I might ask you which suture separates these bones. And notice I didn't have any landmark for the parietal bone. I need something for the parietal bone at least. So you're born with soft spots. They're actually very scary when you touch them. You're like, oh my goodness, it's soft, it's not bone. you actually cannot press into the baby's brain. So I like naming these soft spots for where they are. They have two naming systems though. And they're called fontanelle, or fontanelle is this plural, singular. Now, the reason for these fontanelle, or fontanelles, is for compression of the baby's skull. So these bones are actually going to slide in there. These bones are going to slide over. This bone actually gets compressed in. And you can see actually these sutures, the squamosal suture, the coronal suture, that's the frontal suture, are actually not really formed. It's actually dense, regular connective tissue, which would be a ligament. And the baby's head squishes. So when the baby is born, the nurse is going to put a hat on their head, and they're going to say, oh, it's because the baby's cold. And the baby probably is cold. He just left a 98-degree water bath. However, it's also because the baby is born with a cone-shaped head, because those slide together. And they don't want to freak mommy out. So, on the sides here, side is lateral. So this one right here is the anterior lateral fontanelle. And then I need to scroll down. We have the posterior lateral fontanelle right there. Now, the other naming system, this is the sphenoid fontanelle because it's between the temporal bone and the sphenoid. And you have your mastoid process right there. So this is called the there's the mastoid process. I missed. The mastoid process is right there. So this is called the mastoid fontanelle. And you know I was swearing about how my pen isn't working when I moved it back up, right? So, our last two fontanelles, frontal or anterior is right here. And then our posterior one would be between the two parietal bones and the occipital bone. So that's the naming system. I will use the directional term one, not the name termed ones on the tests. So, this is how I'll ask. Which suture is between the parietal bones that separates into a left and a right? It is sagittal. Which suture allegedly, according to your textbook, surrounds the temporal bone? It is not temporal. It's not squamosal. I mean, it's not temporal. It's not sagittal. It is squamosal. Which fontanelle is by the mastoid process? Remember, I completely missed the mastoid process. It's right there, by the way. That would be the posterior lateral. What is the purpose of fontanelles? Model of growth? No. Do you remember what most bones besides these bones grow from? That's right. They grow from cartilage, except these skull bones. Allow bones to fuse together? No. Allow compression of the skull for childbirth. So, we are going to look at the vertebrae in our next video, and you'll be able to identify the curvatures. You will be able to identify the different types of vertebrae and talk about shared structures and unique structures. So, thank you very much.